lecture is on digital imaging, and I'm going to go through just quickly these lecture objectives. Understanding the principles of digital imaging and how those images can be used in a dental office, and then discussing the advantages and disadvantages. We'll start with the advantages. The use of the standard X-ray tube head equipment. So one advantage is there's not a lot of purchasing new equipment as long as it's relatively up to date. If you have an older unit, you may have to replace it for something newer, but as long as it's relatively up to date, you're fine. Fast retrieval of images, so it's pretty much instant. Before you get back in the room good, the image is already on the screen. Digital radiograph does have a reduced radiation dose to the patient. It takes less radiation to capture an image on a sensor than it does to capture an image of film. Advantages for storage because there's no scratching, no lost films. You don't end up at the end of the day with 2 or 3 films just on the floor loose. They've fallen out of the mount, they've fallen out of the patient's chart, and you don't know who they belong to by the end of the day. Plus, from patient visit to patient visit, there's no scratches or damage to the images themselves. Remote consultation, it makes it extremely easy if you are referring a patient to a periodontist or an oral surgeon. You can email, essentially, the images from the office that you're working at to the office you're referring the patient to, and that way, when the dentists are communicating back and forth, they're both looking at the same images and do a better consultation just because they have the same images. One thing to be mindful of there is you would need to have the patient sign a release, because just because they're a patient of yours and a patient of Dr. Smith, the periodontist, doesn't automatically mean that you can just share information. You would have to have a release from the patient to do so. Digital radiographs are environmentally friendly because there's no processing chemicals. So when you process films, the developer has to be disposed of, and the fixer is even worse because the fixer is what pulls out those unexposed and undeveloped silver halide crystals. And whether it's silver halide or silver bromide, it's considered a heavy metal because of the silver. So when you're disposing of fixer, you have to be careful not to get heavy metals into the water supply and that sort of thing. A lot of offices have gone paperless, and so if you have a paperless chart office, then you would want digital radiographs. Otherwise, you've still got a chart with just the radiographs in it, which a lot of offices who are converting from traditional paper to paperless, a lot of times they will have a period of time where they either have digital radiographs but not charts, or the other way around, where they have digital charts and they keep radiographs in a folder with the patient's name. So once that transitions over, typically that goes away. Infection control is one of your advantages because you're not having to carry contaminated films from your exposure room to another room to be processed. Okay. The disadvantages of digital: sensor placement. Patients always complained that the film cut and hurt, and that it was not comfortable. Well, the sensors came in and they wanted their film back because where the film would bend and give a little bit, the sensor doesn't. So oftentimes you have to kind of work around the patient's anatomy a little bit more to accommodate that sensor, and it's not super comfortable. So just be aware. The definition of the images is much better than it originally was, as they've just developed better sensors, better software. So the definition is continually improving with every generation of digital imaging, but it's still listed as a disadvantage just because it isn't as crisp as the film was. Infection control is also a disadvantage because the sensors themselves are not autoclaved. You put a barrier on them, but the barriers tear pretty easily, and then you're just disinfecting rather than autoclaving. So for that reason, since it's a hard item to disinfect, it is listed as a disadvantage. And of course, the disadvantage that most people think of when they think of converting from traditional to digital is the cost. The $10,000 to $15,000 conversion is per unit. So if you have a dentist office where they have 2 operatory chairs and 2 to 3 hygiene chairs, that's total of 4 to 5 units that would have to be converted either one at a time, typically not all at one time, but that's 4 to 5 units times $10,000, and that's a very small office. So imagine if it was a larger office, how expensive that can be. Your standard radiographic film is your recording medium, is the way that the image is displayed, and it's also how the image is stored. And it requires higher radiation and chemical processing. So we kind of talked about those. But just by comparison, digital radiographs, you have a pixel image. You're able to manipulate that image, meaning that if you take it and it's too dark, so your density is too much, you can adjust that density. You can adjust the contrast. You can make a lot of adjustments to the image that normally would have had to have been retaken. So you don't have to take as many retakes as you would have with film. And then you're also able to see the images immediately, so you can correct errors, or if you know you didn't get the apex of one tooth, you can try to catch it in the next image, where with film, you wouldn't know until everything was processed at the end. Storage is easier because everything's just filed, saved. Retrieval is easy and very quick. And then also transmission of those images via email or saving to the cloud and that sort of thing. We talked about density and contrast can be changed without re-exposing the patient, which again is another safety feature. You reduce the amount of radiation per exposure, but you're also reducing the number of exposures by limiting how many retakes you have to take, by being able to correct those. And we already talked about the images are retrieved almost instantly. The equipment that you would need for a digital radiograph system is just your standard X-ray machine. You do need an electronic sensor, which means you've got a cord that plugs into a USB, or a phosphor plate. And we'll talk about the phosphor plates in just a second. That is a photographic plate that has to be scanned by a digitizer, and I'll show you that in just a second. So there is another step to it, but it is considered digital. You do need a computer. You do need a digital converter or digitizer, which is built into the electronic sensors, but it is a separate piece of equipment for phosphor plates. And then you need a way to display or view the radiograph, so either a monitor or a printer, or both. This is just something I thought was interesting before we get into too many of the images. Something that's very common in digital radiography is digital subtraction. And what they do is you take an image, let's say you wanted to see periodontal bone loss. And so you would take an image, have the patient come back in 4 months or 6 months, take as identical an image as you can, then the computer can place those 2 images on top of each other, subtract them, and really highlight and only show the differences. And so what you would highlight and see were very small changes in either the bone level, the bone thickness. Carious lesions or incipient lesions would be more visible, because when you subtracted the 2 images and looked at the difference, it's going to show you where calcification was lost in the tooth surface. TMJ condyle loss. So a lot of oral surgeons and prosthodontics have used these to be able to see wear and tear on that TMJ joint area. Implants. This is huge with implants because you're able to see if that osseointegration is happening. You're able to see if the implant is accepting or failing. And you can see these things very early on because you can see those very subtle differences, which that's unusual with film. You wouldn't be able to see small, subtle changes. And so that is one of the big advantages to digital. So now we're going to look at some images. And I put these in here. I know some of them are fuzzy because I think they were trying to fuzzy out patient names. But you can get the general idea. Digital radiographs are great as a tool for patient education. So here the dentist is showing the patient, this is the tooth, and you're able to blow it up so they can really see the difference in the different structures. I mean, that's huge. Her molar is literally the size of the screen, but he's able to show her, whatever it is that he's pointing out. This is a bite wing, and you're able to see how it plugs. They've pulled it out of this full mouth series here. Here she's able to look at and really blow these images up. And traditionally, you see digital imaging where they utilize a desktop. But remember, this is all done with USB, so you could very easily have a laptop to make this a portable situation where you'd be able to see it and be more mobile. So if you're doing mission work or something along those lines. Okay, so traditionally you have a pan here. You've got your full mouth series here, and you can see what you're pointing out is that impacted canine. And even we've thrown in some occlusal images just to really show you what traditionally was available as far as imaging. But with digital, in a lot of cases, they actually take it a step further, even if whether they were film or if they were digitally acquired, those would be the traditional images. But with digital, you're able to take that information and a computer can create 3D models. These pictures are several years old, so they actually have better graphics and just better visualization now. But if you're trying to explain to mom why it costs so much to have those teeth extracted, or in this case, they're probably going to have severe orthodontic treatment involved, and when you're trying to explain to mom why it's going to cost so much, you can actually show where the tooth is sitting exactly, and that's easier to envision than the traditional images. If I could show 3D, this tooth needs to go here, this tooth needs to go here, much easier. And these are just some fun options that are available in digital. This is a polarized image. You've got kind of a polarized image here. In a lot of cases, if you're trying to explain to a patient that you're pointing out this gray area here, well, no, not that gray area, this gray, no, that gray area, no, the darker one, no, the lighter one. It's hard to explain sometimes to patients in terms of gray. So if you could say, okay, see the red thing, that's your crown. See this red thing, that's your really big filling that we need to replace it so that it looks like this crown. It's easier sometimes with the polarized image to point out red versus green or purple versus green versus just gray. So that kind of makes it a little easier to communicate with patients sometimes. This is a format that it's available for all of the digital radiographs that I've seen. I don't know what its purpose would be, but it's just kind of fun. Okay. So this goes into a little more detail. It's good reading. It talks about the introduction of digital radiographs and filmless imaging, and it just kind of gives you a sense of history. So read through those slides. I'm not going to read them for you. I want to get down here to the good stuff. So on this particular slide, scroll and adjust it just a little, you can see the size 0, 1, and 2 film compared to, this looks like a size 1 sensor, and they've got it now in the barrier here. Just size-wise and thickness-wise, you can see the difference. With these images, let me scoot up just a little, you can see where they're actually scanning. Nothing fancy there. Literally, they took an image traditionally with film, and then they're scanning it. These are just different variations of sensors. Of course, they have digital panoramic machines, and that's just showing you a sensor. I want to click to here. Okay, so this is a digitizer, and if you're using phosphor plates, so this would be a phosphor plate for an extraoral image, so it's rather large. And so what they do, it goes into the cassette to go in the machine. You expose the image, then you come back, you put it on the digitizer, close it, like this one's closed, and it goes through a cycle and scans that image, and then it shows up on your computer.